you're seeing me for the first time, I'm Mercy, and I just want to welcome you to this live this morning. Yeah, I have a question for you this morning. Are you also experiencing conjunctivitis in your community? Yeah, this red eye disease has become rampant and it's consuming rural communities like fire. Yeah, recently we have rising numbers of cases of viral conjunctivitis in my community. That's why I am here today just to share about viral conjunctivitis. Okay, so conjunctivitis is just inflammation of the conjunctiva. The conjunctiva is that thing covering around, that covers the white part of the eye. Like you can see my eye. Then there's that white part, okay? That white part of the eye is called the sclera, but it has a thin layer, a thin semi-transparent layer that covers it, and it also covers the inner parts of the upper and lower eyelids. Okay, that inside part of the lower eyelid and then the upper eyelid is also lined by the conjunctiva. So when you get infection or of any kind or allergies, that layer tends to get inflamed and it becomes red. What makes it become red is that uh, the blood vessels enlarge and they become prominent. So you start seeing the eye as red. But today I'm very interested on this epidemic red eye, which is almost I'm getting information from all over so many countries. Yeah, Kenya is having red eye, Tanzania is having red eye, Uganda, my very own motherland, is having red eye, and not just Uganda, my community, my neighborhood, people are having this red eye, you know. But what is the cause of this epidemic red eye, which is there? Because it is very contagious and it spreads easily. So these are mostly the very contagious type of conjunctivitis is usually caused by infection. It could be viral infection or bacterial infection. But for this recent one, the one which is there right now, it is of viral cause. Yeah, there are a number of viruses that bring about viral conjunctivitis. We have adenovirus, we have herpes virus, we also have Coxsackie virus. Yeah, there are a number of them, but the commonest among the very many viral conjunctivitis causes viruses is adenovirus. Yeah, and this adenovirus, by the way, causes a number of diseases. Adenovirus causes upper respiratory tract infections, it causes conjunctivitis, it causes diarrhea in children. Yeah. So the pattern of this red eye that is in my community, usually it's associated with respiratory tract infections. The patients are having sort of flu, they are having cough, a little bit of fevers. Yeah, the little children, the toddlers are having diarrhea. We are having a lot of diarrheal diseases also in our rural community here. So this adenovirus is causing a lot of issues for my local community, my fellow villagers here, and I'm worried about that because what makes me worry more, the lifestyle in my village community is facilitating the spread of this virus so much. Okay, in my village we are social people, you know. When we have a burial, we are collected in crowds. Our primary schools and secondary schools are too congested, you know. And then also, we don't have washing facilities, even if they are not there. Even if they are there, my community is very poor in hand washing. So if your community also where you're staying is having this kind of lifestyle, this lifestyle spreads, yeah, promotes the spread of this red eye so fast. So let's having known the cause, that is adenovirus, which is the culprit here, and then we know the other diseases that adenovirus can bring, which include upper respiratory tract infections, diarrhea in children, and then conjunctivitis. Let's look at the spread. Yeah, how is this contagious red eye spread? Now, the red eye here is spread through contact with discharge from an infected person. Yeah, the discharges here could be droplets from a sneeze or a cough of a person who is having viral conjunctivitis, who is having this viral conjunctivitis, because it's also associated with upper respiratory tract infection, or direct contact with a discharge from the eye. Okay, and the hands are responsible for this spread. Yeah, you touch a discharge from the eye, you touch your face, yeah, you get the what? The infection. Yeah, if you interact with a person who has viral conjunctivitis, and maybe by coincidence you happen to touch where that person has touched, the chances that within 12 hours your eye might have become red as well. Yeah, this disease is just so contagious. Yeah, so the emphasis we want to put more here is on fomites, because I see fomites are very responsible for the widespread of this this red eye. What are fomites? Fomites are these inanimate objects that can work as vehicles to facilitate the spread of this of this red eye from one person to another. And the fomites here, we have things like tables, working tables, where different people touch. We have things like door handles where different people touch. Even phones are responsible for this red eye spread. If you have a phone that you always share, the one person has a red eye, is using that phone and then gives to another, it can also be a source, a carrier for that a vehicle for transmitting the red eye from one person to another. We have things like towels, yeah, no, those are the things that are actually personal effect things. We have towels, we have handkerchiefs, yeah. We have, like in my community, women like tying laces, these clothes that they tie around the waist in the village. And then when you sweat, you get that cloth, you wipe the face. When the child comes and is crying, you want help to calm the child down, you find a mother using the same cloth to wipe the baby's tears and calm the baby down. Yeah, you find a mother using the same cloth for cleaning a baby's nose. Maybe the baby is having flu. Yeah, Then you use the same piece of cloth that you've wrapped around your waist for cleaning the baby's nose, you see. And then if one of you has a red eye, you're going to spread it. Within no time the whole family is having what? A red eye. And then also things like utensils, say for instance cups for drinking, assuming this person has a red eye, is not washing, is touching the cup, is touching the plates, is touching, yeah. Then also other family members are sharing the same things, they can also work as what? Vehicles for transmitting this red eye, because somehow you've touched your face, you've touched those shared utensils, another person also touches, so you get it. And then also we have things like bathing basins for bathing. In the village we don't use showers, we don't use, yeah, we don't have overhead showers for bathing, so we use basins or buckets. So you may find in a family we have maybe two basins and everybody uses the same. This one carries and uses for bathing and then brings back. Another person also carries, yeah. You see, so this basin is working as a format, a vehicle for carrying the what? The virus and transmitting it to from one person to another. We also have things like sharing beddings, yeah. That is another problem in my rural community. Yeah, children, especially children share beddings. You can have one bed sheet shared among 3 or 2 children. You can have one bed shared among 3 or 4 children. Children are usually they lay for them their bed on the floor, yeah. It could be mats, they lay them on the floor and the children just line up to sleep on the floor. That's the life in the village, yeah. And then they also share a bed sheet, you know. Sometimes children share even clothes. This one also wears the same clothes, the other one also wears. So those are some of the lifestyles that are really, yeah, fueling the faster spread of this red eye in my community, in my village community. Maybe your village community also has that lifestyle. Let me know in the comment section down below, because if we want to tackle to stop the spread of this red eye, we have to first identify what are the things that are possibly facilitating the spread of red eye. Okay. Another thing that I want to speak about on the spread of red eye is swimming pools. A swimming pool can be a reservoir for this red eye, because swimming pools are shared, and if a swimming pool is not well maintained, yeah, it can be a source, a reservoir where people go and pick the virus of red eye and take home, okay, or and take wherever it is. So the virus will keep being there, yeah. So swimming pools should also, and then also saloons, yeah, saloons. When I look at the saloons that I've reached in that I've been to in my country, in my hometown, hygiene is not up to standard, yeah. You see, they share these face towels after facial scrub. You find a very dirty stained towel that is used for wiping from one patient, from one client to another. They are wiping using the same one face towel, okay. If that towel is not well washed and sterilized, it could be a vehicle for transmitting red eye in the community. And then also we have what is this? we also do have things like makeup kits. Yeah, yeah. So if you're a makeup artist, we need you to help us to control the spread of this disease. So if you're sharing this makeup, the makeup brushes, I don't know, the brushes you're using from one person to another, should you happen to work on a client that has a red eye, and then you're using that makeup brush, you're putting it on the client's face and you're putting it in the makeup, so you're going to leave the virus bringing red eye in the makeup, and the next client who is going to use the makeup is going to get a red eye definitely. Yeah, so those are some of the things that are fueling the spread of what, of this red eye in our community. So it gets worse with the village because one, hand washing facilities are inadequate, and also hand washing, my village people are poor in hand washing. You can do hand washing or you can do sanitizing. So, and then because our families in the village are always crowded families, we have very many members in the family, and you find these members in the family just people who are living this social life. They move out most of the time. They are in trading centers, in groups. Yeah, they are in drinking joints. Yeah, it's another problem. People who happen to be drinkers, especially in my village, okay? Drinking is done in groups. They put the alcohol or the malwa in one pot, and then they have a few, I don't know how to call those tubes, the tubes they use for drinking malwa. They can have like 3 tubes or 4 tubes or 5 tubes being used among 10 people, or even 20 people are seated around a pot of our local brew, and then they drink and give from one person to another, from one person to another. So if one of them has a red eye, I'm telling you, by the end of that drinking session, a number of them would have got what? The red eye. Yeah, the red eye. And then let me chip in something. In my community, I've seen the adults say the red eye is being spread by the children because it's more in school children. Yeah, the red eye is very more in school children, and the adults say it's the school children who are bringing for them red eye home. Yeah, well, data or statistics has it that this viral conjunctivitis is common. It's more common in what? In children than in adults. Yeah. And bacterial conjunctivitis is more common in adults than children. Statistics have that in record. So possibly these children suffer more from viral infection, because of their lifestyle. Children play in the soil, children do what. So a lot goes on around the life of children. And also when we look at school, children are too social, and they tend to share everything with their colleagues, irrespective of whether they have a red eye or what. So we have more children with red eye in schools, and also because we have big numbers. My community schools here in my village, you find a school is having over 1,000 children. Yeah, some schools even threaten 2,000 children. You may find in a class, one stream is having over 200 children, and they are all packed together. The teacher even has nowhere to pass. Okay, and then yeah, the books the children use. The children are using books to write. The teacher handles all the books mixed together. For us, you collect the books, then the teacher uses for marking. Remember, this child is having a red eye. It is irritating the child. So most times the child is touching the red eye, is touching the book. So yeah, 100% the book is having what? The virus on it. So at the end of the day, you find whole class can get red eye in just no time, and they go back home with this red eye. So, and then the other thing on our lifestyle, in my village, we love greeting, shaking hands. It is a tradition. If you greet somebody when you've not touched the hand, it's not like it's a normal greeting. Yeah, any friend of yours, you have to touch the eye, to touch the hand. Esther, Esther, can you help that baby? Help the baby. Don't open there, but help the baby. Help the baby to keep quiet. What does he want? What does he want? You can take him to daddy. Okay. So sorry about that. I have a toddler and he's crying. I don't know what he's crying about. Either he wants to come to me or he wants something. So I'm very sorry for that interruption. But we're looking at the lifestyle, handshaking. It's a common phenomenon in my village, in my rural community. You find that sometimes people handshake even when they are not consciously aware that they are handshaking. Yeah? You just find yourself saying hello to somebody and touching the hand. Esther, Esther, you open for him. Open for him the door to come to me. You open. Open for the baby the door. And then you lock the door, then you go and play. Okay, baby, what is it? Okay, sorry about that. So that is the kind of lifestyle that is in my village, and it's promoting red eye so much. So let's see. Leave that door. Leave that door. Leave it and go away. Okay. So you find that really encourages the spread of this red eye in my community, in my village. Actually, when I started receiving cases of red eye in the health facility, I was really so worried. Sorry, baby, sorry. Okay, sorry. I was really so worried about the situation, because knowing the lifestyle of my people, I was so worried, and I knew that this is going to spread so much. Because another thing that my people do in the village, especially for the children, is to put for the children water in a basin and just share to wash their face. You find they put the children water in the basin. Let me just carry somebody. Okay, keep quiet. Okay. They put water in the basin and then they use it to wash the face. One child after the other washes the face in the same basin. So it is also a very big problem, and it's something. Sorry, baby. Sorry, let me finish this and then I'll give you to breastfeed. Okay. So that is how life is in the village. Yeah. Share with me the situation of red eye in your village, in your country, in your community. Just share with me how the situation there is, And what are people probably doing in order to settle this problem? What things are people putting in place so as to stop the spread of red eye in the community? So let's look at the treatment or management of red eye. Actually, the treatment of red eye is just a symptomatic treatment. It is not aimed at eradicating the virus, because the virus is a self-limiting what? Um, this viral conjunctivitis is a self-limiting disease. So the treatment basically aims at relieving the symptoms. You get some relief, okay? And usually here we do use eye lubricants such as artificial tears, and then antihistamines. Yeah, these are the basic drugs that we use to manage red eye. And then we also can use some painkillers, especially the NSAIDs. Yeah, like ibuprofen, just to deal with the pain and the irritation. Yeah, but the disease can heal on its own. Yeah, basically like after 3 weeks, you could have get off the red eye. So there are things that we encourage the community to do so as to stop the spread of this what? Of this red eye. Things like hand washing are very important, because as you do hand wash with soap and clean water, you are trying to stop the spread of this condition, and also stop the infection, stop infecting yourself with the what? With the condition. And then also avoiding crowded places can help in controlling the spread. That's why I do encourage, if you have a red eye, stay at home at least for 2 weeks, because from zero to 14 days, that is the most contagious period of this viral conjunctivitis. That's when it spreads more. So if you stayed at home at least for 14 days from the time you get your red eye, you will not spread to very many people. And then we also want to stop sharing of personal effects, and then taking care of disinfecting these what? Fomites. Disinfect door handles with sanitizer, disinfect working tables, also computers. Make sure you wipe them with sort of alcohol so that you get rid of traces of the virus in case you're sharing a computer in your office. Yeah, sharing phones, make sure you disinfect your phone, wipe your phone with the alcohol, and try to get rid of any viruses on the phone. We want to make sure we avoid handshaking. Yeah, avoid handshaking, because handshaking is another serious thing. Also, this virus is spread through cough droplets from sneeze or cough. Yeah, because I've told you that adenovirus also brings upper respiratory tract infection and also causes diarrhea in children. So if you're infected with the adenovirus and you're coughing, you're having an upper respiratory tract infection, you're having flu, you're having cough, yeah, those discharges contain the what? The virus. And if anyone gets in contact with those, so they can get what? This viral infection. So you also want to make sure you cover your mouth. If you have cough, put on a mask. Put on a mask so that when you cough, you don't spread what? droplets from a sneeze or from a cough in air, because this condition can be spread through air as well. It's airborne also. That's why you see the spread is really like fire. Okay, so you want to make sure you're doing that. Wear your mask, wash your hands, sanitize. Yeah, avoid touching your face. Try as much as possible to keep your hands off your face, because hands are carriers of this. They pick up this virus from anywhere, the surfaces, what. So avoid touching your face. Make sure you don't touch your face anyhow, especially with unwashed hands. At least if you want to touch your face, clean your hands with either sanitizer, or you can clean them with soap and water before you touch. I also do encourage my people in communities with schools, with children, take care of these children. The sanitation levels should up. Yeah, yeah, improve on the sanitation in these schools. Yeah, because a lot of children, school children, are getting this viral conjunctivitis. Give these children information. Our teachers health educate the children. The health workers in facilities near these schools, give your time to these children. Go and give them health education sessions on hand washing. Yeah, about this general, about this viral conjunctivitis and the way it's spread. Also our VHTs, yeah, we have village health team members. Please give information to the community about the spread of this viral conjunctivitis. Our chairpersons in the villages, the LOC ones, yeah, health educate people during burials. You know, during burials, there is this African way of how do you giving condolence to a person who has lost a loved one. All of you want to go and greet that person, shake their hand, and then you have some money. You want every person has to tie that money on the cloth. Yeah, the person who has lost somebody is putting on. So everyone touches that cloth and ties the money, That's how we do it traditionally here in the village. So that kind of behavior also is facilitating the spread of this viral conjunctivitis. In other words, if we handle the fomites, these objects, these materials that can work as vehicles for spreading this red eye, if we handle them and deal with them, we can lower the spread of red eye, and probably our community will get out of this epidemic outbreak. Okay, so the other thing that you also want to do at home is to apply some warm compress on your eye. Yeah, because by applying the warm compress, you're trying to help to make the oil glands function better. The oil glands are just along your eyelashes there, the lid margin. We have a number of oil glands there. So when you apply a warm compress on your eyes, you help to melt the oils there, and yeah, the oil glands will produce more oil, and also will help to lubricate now and improve on the tear film, so that you try to deal away with the irritation, the dryness in the eye, because this condition you tend to get that mucoid discharge. It's mucoid, it's actually not pus-like or not purulent. It's a mucoid discharge. So sometimes when you sleep, even when you wake up in the morning, you see the eyes are stuck and there is this white crust. It is not actually a discharge, but I mean a purulent discharge, but you find like the white crusts that are just keeping your eyelids stuck together and you struggle to open. So that those crusts can even easily block the what? This the glands, the oil glands along the what? So you don't want that to happen because it will give you a more dry eye and irritation in the eye. So you just want to apply a warm compress so that you have your oil glands functioning better. And then you can alternate between warm compress and cold compress. Yeah, because there is also a little bit of itching in the eye. So you can, if you feel the itching so much, you can apply a cold compress on your eye. So thank you so much. I've shared with you what I could about what's going on in my community. People are really so scared about moving around. They're so scared. They're worried about this red eye. They are wondering what could be used to eradicate the red eye. But I just want to give reassurance that if we keep good sanitation and hygiene and follow those steps that I've shared about today, we can really handle the red eye situation and bring the number of cases down, because we know this is a viral condition and viruses cannot be treated to eradication, but we can prevent the spread and we live free life from these viral infections through improving our sanitation levels and hygiene. So thank you so much. If you happen to watch this video as a replay, or if you're watching it right now, remember to give it a like and also subscribe to my channel and leave me a comment down below. Bye for now.